morning, good afternoon, good evening from wherever you're calling in from. Welcome to our Generative AI Healthcare webinar with our friends at Galen Growth. Galen Growth is based all over the world now, everywhere, Singapore, Europe, and North America. And the Galen Growth Health Tech partnership has produced some amazing reports. This is the one around the use of AI and generative AI in healthcare. The data set that the Health Tech Alpha product has is quite large and substantial, and we are really glad to have on our calls today 3 people who are going to talk to us about not only the report but just in general what is happening with generative AI and specifically how is it impacting the delivery of care, the healthcare world that we're living in, and is it creating any inequities? And I'm sure we'll have some really interesting conversations. So with that, I'm going to kick it off with some introductions. I am Ritesh Patel. I work at Fin Partners in New York. We are great partners of Galen Growth, and we love the data that they generate. So happy to participate. Sara, over to you.
Thanks, Ritesh. I'm Sara Schmachtenberg. I'm head of data and analytics for Galen Growth, and I enjoy publishing such reports to showcase the data that we have in Health Tech Alpha. Galen Growth is the global leader in digital health data analytics and intelligence. And with that data, we can show the trends, what's actually going on, not the hype, but the data behind what's actually going on. Glad to be here today, Ritesh.
Fantastic. Thank you. Gil?
Ritesh, thank you very much for bringing us together. And Sara, thank you and your team for generating these reports, which I use extensively as I travel the world and counsel clients and, of course, step on to in real life stages. I'm Gil Bashe. I am chair of Global Health and Purpose at Fin Partners. I'm also editor-in-chief of Medica Life and was the author of the extremely popular, well-read, the 20 top leaders in AI around the world, which immediately had about 10,000 reads in a blink. So this is a topic I'm very passionate about. I think that Sara and her team have given us a foundation that will guide us in terms of where companies invest their dollars and where they sweat out some of the public policy issues. So I'm thrilled to be with both Sara and Jane, and certainly always with Ritesh.
Thank you. Jane, over to you. Lovely San Francisco.
Yes, good morning from San Francisco. Thank you so much for including me. My name's Jane Myles, and I've been working in clinical trials my entire career, but right now I am the navigator between the reality of clinical trials and how innovation gets embedded into them. So we'll think of me as the pragmatic innovator trying to make these new possibilities a reality.
You do keep us honest, that's for sure, Jane. So participants, if you, during this webinar, if you have a question, you can use the Q&A function, drop your question in there, and I'll keep an eye on that and make sure that we address any questions you have. Big shout out to Ravi Bala. Thank you, Ravi, for joining us this morning. I know him personally, so glad to see your name on that list. Welcome, welcome, welcome. Okay, Sara, over to you. I think, the report was very insightful, and I know a lot of the attendees may have received a link to download or actually preview it, but could we go through some of the sort of the high level findings and the golden nuggets that you guys have discovered in this data that you've presented?
Absolutely. Thanks, Ritesh. So the report's about Gen AI and AI in digital health. And what stands out, really the first number that you see when you open the report is 2%, right? 2% of ventures in digital health. And we're talking about more than 12,000 ventures across the globe do use Gen AI technology. So we're still talking about a very small percent, right? Gen AI isn't widely spread throughout digital health. It's still a very, very small corner, but it's growing, and it's an incredibly powerful corner to be in, right? If we look at the ecosystem, what does it look like? 27% of those ventures using Gen AI are in health management systems, right? And those are the digital backbones, right, of our health systems, of clinics. And that's why we see a 2x increase in partnerships in health systems, right, using AI, using Gen AI, because they're realizing the potential of this fantastic technology, and the partnerships are just really skyrocketing. Where is that potential? That potential is in a lot of scribe technology, right? As far as physicians using Gen AI to help write clinical notes, right? To pull data out of EHR systems. So that's a big, exciting corner in Gen AI. The other corner that we found when we were writing the report, Ritesh, was in biopharma research, right? Using the generative AI technology, because it's not only for writing words, right? If you train it with molecules, it's going to spit out molecules. So using the Gen AI to do drug discovery, right? And do molecule discovery. Those are really two potentially big corners for Gen AI in digital health. And it was exciting to understand, right, where it's really actually being used today. There's a lot of potential other places, and I'm sure we'll talk about that today, but that's what we see right now. As far as geography, the Middle East is always a very dense region, especially Israel, right, for AI and Gen AI ventures. So we look to Israel a lot to see what's the new technology coming out, especially when we're talking about AI.
Fantastic. And what about some of the startups that had been using it? As we sort of noticed a little drop in, the number of companies that are using AI. Well, we were talking about that just before we went live. Where are you seeing that, and what do you think the reason behind that is?
The drop you're talking about, I think, it's really in the partnerships we've seen in 2022, and now in 2023. We've seen a bit of a drop in the number of partnerships that are being generated across digital health completely. Mm-hmm. A little bit more so in ventures using AI. It's really we talked about this a little bit in our pre-discussion. Kind of sorting out who's really doing it and who's just talking about it, right? Understanding, okay, now we're seeing the partnerships being focused on the ventures that are producing results and producing evidence that they're actually creating a benefit to the system.
So very quickly, Georgie and Ravi, you asked about where you can get the report. I put it in the Q&A. Hopefully you can get it, and anybody else who hasn't got it yet. So that's the briefing. Gil, over to you. You're global. You're really deep into this. You just published those top 20 or top 10. My name wasn't on the list, by the way.
I owe you, my friend. I owe you. Next list.
What are you seeing from this? Are you seeing a shift from the ventures, from startups in this area?
Yeah, look, first of all, I just want to return to what Sara just said, because I think it's very, very important. And I would recommend everyone on this call and everyone who subsequently listens to the webinar to try to get your hands on the report. It is illuminating. And the report touches on more than just partnerships. It touches on policy issues. It touches on who will be the players that devour the big fish, who devour the little fish, and so forth. And I think it's well worth, shall I say, scraping the report to get insights to steal from Gen AI. Look, I see two things happening. One also, Sara, I'm heading to Israel in a little less than 2 weeks. I'll be there as the keynote for the mHealth Israel conference. Maybe I'll talk about Gen AI. Who knows? But
I think they know it already.
but other things. Look, I want to divide this into two categories on Gen AI, which is making money now and making money tomorrow. And making money tomorrow, I'll also include efficiencies of the system, which you touched on quite accurately, which is even the development or scoping out of future molecules, or even a trial design that reduces disparities in inclusion of participants. Gen AI has the capacity to guide us there in the future. But let me just stay for a moment right now in terms of where I think Gen AI is going to make some big economic impact on the system. This country particularly is the world's largest chaotic health system, the United States. Israel, where they're perfecting a lot of the Gen AI technologies, is totally different because it's a closed loop system. You've got 3 health insurers predominantly, all aligned with hospital systems, all aligned with pharmacies. The ability to get patients to adhere there is crystal clear. How they're able to conduct clinical trials all of that has been, I don't want to say perfected, but we can comfortably say fine-tuned. So that's why that market has been a great boon to Gen AI. Plus, they have more engineers per capita than any other nation in the world. Put that together with an influx of some really amazing private equity firms that are based there that have gone global from Israel, and you're going to have a slam down on the accelerator of innovation to get things going. But there are certain things that when I'm over there and I'm speaking to no longer startups, but companies that are moving pretty darn fast in the Gen AI area that you touch on, is they have really pinpointed the fragmentation of the US health system. We have little collaboration or cooperation between health insurance companies, payers, and providers. In many regards, they're not in harmony with each other. It's two distinct business models, one that survives on sick care, one that survives on trying to figure out how they rationalize care. And then
you've
we're
got
in
the
the middle.
PBM in the middle. Don't
Yeah,
forget
and the
the
PBM's
PBM
in the
in the
middle.
middle.
Well, I think the PBM is its own like player.
Yeah.
The PBM is playing the odds.
Yes, both
So
sides.
right, we have this very fragmented system. And doctors, this is a great book, by the way, I highly recommend, Fragmented by Ilana Yurkovich. She's a Stanford physician. She's actually an internist, a hematologist, and an oncologist. And she writes about how systems like Epic really are chaotic. So I want to deal with the here and now of Gen AI, which I think a report touches really nicely, and why I think you chose, I guess, the big four that have jumped in, like Amazon and Microsoft, and all these amazing companies that are really going to, sort of like own this, I think, in the end. First and foremost, our health provider systems in this country particularly, but around the world, need to scrape data to make sure that patients are getting the care they need. That's one. In a chaotic world where electronic health records are kind of like, I'm going to call it a chest, a memory chest where people dump data into, but can't figure out what's in it at times. The ability to use Gen AI, intelligent language models to scrape data and to say what is going on with this patient, I think is going to be a big moneymaker for the health system. It's going to enable them to look at care that the patient has not received that should receive, care that the patient has received that the health provider system has not submitted a bill to the payer for. And it's also going to look, I think, at liability issues of saying, did we miss something that we need to now sort of circle back and make sure that patient has? So a lot of times we're talking about innovation. I think Gen AI is, first of all, has the potential to bring efficiency to the health system that we don't currently have. And I would highly recommend for people who are getting into the Gen AI game, or hospital systems that have incubators, accelerators, and even equity groups, to consider their role in, Sara, to your point, jumping in and creating partnerships. So I'm going to talk right now. I just wanted to talk right now about the here and now of Gen AI. It's not a futuristic technology. It's a technology that the health system, certainly of the United States and around the world in developed nations, needs ASAP in order to maximize the greatest potential of healers that want to help and people who want to be healed. Gen AI is needed today.
Really interesting, and I think we can explore that a little bit more, but I'd like to go to Jane around the world of clinical and research and development, because in the report, there is an identification of a few use cases for things like early stage drug discovery, in silico trials, digital twins, things like that. Are you seeing, is that where it is right now, or is it being deployed for clinical trial recruitment and collection of data and all that sort of stuff?
Well, yes, it's a yes and.
Okay.
And I'm going to point out first that clinical trials and healthcare are connected, but not at all the same. And I think that gets lost a lot as people are thinking about developing solutions. Gil, to what you just said, Epic is a backbone, but it has osteoporosis. It is so very fragmented. And when we're doing clinical research, one of the fundamental things that is an amazing friction point is getting the actual diagnosis of the patient. This gets amplified a lot if you're using a lot of sites and the patients are coming from new locations, and that interoperability challenge of the fragmented healthcare system gets very magnified. So that is something that I'm hoping we can solve a little bit by scraping data and looking at ways to connect things better. In terms of drug discovery, I actually think that's been ongoing for quite some time. It's just getting fueled differently with these large language models and these new analytic tools. On the other side of the house, in terms of downstream clinical development, I've been really impressed speaking with big pharma organizations about how it has actually transformed their manual workflows. For example, one of the big pharmas took the time during COVID to take all of their clinical data over the past X years, multiple trials, multiple therapeutic areas, take it out of the actual silos, put it into a flat file. And now they're using it to actually determine things, Ritesh, like, should we actually do that specific collection at this visit? Is that useful? Did we ever use it in a submission? How much did it cost us? How many times did it cause a patient to drop out? So what I've heard from those folks who are deep in the data is that they're starting to build out business cases to show not just what to collect, but what not to collect. And whether or not the exclusion criteria, Gil, like, let's say a BMI of 30, which could exclude a huge number of patients who don't typically get included in trials. Is that really a meaningful one, or did we just actually put it in because we used it last time?
Jane, you've hit on some key points. I want to circle back to Sara for just a second on something, because one of the things that really struck me, many of the things that you said struck me, but one of the things I'm looking at is not just what we want to do as an industry of innovation, but what the regulators will allow us to do in the long term. And Ritesh, we were talking about this just before we went live, but Sara, this report, which I find illuminating, kind of focuses on globally some of the regulatory hurdles or policy challenges. And I would say, since I'm often tasked to talk about investment in innovation, one of the things I always sort of say is to investors, look at three things. One, look at where the talent is. In other words, does the talent know what the hell they're doing? That's one aspect. Can the talent actually operationalize to the idea? Two, is there a very distinct market need for the idea itself? I mean, if there's no market need, why invent? And three, I say, where there's favorable regulatory policies for the idea and the innovation, and you've got the talent, you have the capital, there's a need. Wow. Now, I definitely feel there's a need for Gen AI. No ifs, ands, or buts. I think one of the concerns I have, and I'm totally in Jane's camp, is the policy environment where the innovation environment is.
But I think
absolutely, Risk. Gil, if I may jump in, Ritesh, do you have?
Go on, Sara. Yeah, go on.
But you're absolutely right. I mean, the policy isn't set yet and that's one of the big risks that we see, right? And many investors are wary about what's going to happen with the policy, right? In the US, it's still a little bit of a Wild West. Last week, they had even more discussions, right, on how do we regulate? How do we develop a policy? Whereas, in Europe, look at the UK. OpenAI has already threatened to pull out of the UK completely because the UK is now pointing and saying, well, the fault is going to lie with the code, the person who wrote the code, right? And So there's a lot of open questions there when it comes to the policy. Going back to something that Jane said about, the clinical trials and the protocols being written and how AI is helping really to pull out this information. And there, you're absolutely right. The Gen AI is being able to take all of the clinical trial protocols that have been submitted to the regulatory bodies. It's great the information, understand what has been successful, what hasn't, and then, suggest a new protocol, which saves so much time for the companies. Jane, I know you're deep into that and you understand that probably better than I do. So there's a lot of potential, but as Gil said, there's a lot of risk sitting there on the regulatory side because we don't really know where it's going.
Yeah,
Can I add,
yes, go on, Jane.
in addition to the regulators, who
Mhm.
actually I think are ahead in some respects, in clinical research, there are ethics review committees, and they serve an incredibly important purpose. And I think that they are at the front end of understanding how to navigate this. For example, let's get practical. We could use chatbots to help patients with the clinical trial awareness and enrollment early pre-screening processes, of course. But the ethics review committees are not sure exactly what to review, how to review it, and whether, like, how far can you let the chatbot go? Exactly what words do you need to approve? So it's interesting because I think we may be adding complexity in our thinking about how to apply the tools because we feel a little bit unfamiliar with how they work.
Yeah, but isn't that I have a distinct dislike for IRBs. I find they're so backward. I
Well, not
detest
all of
them.
them are. There are some that are great.
They need to learn how to use the fax machine now, right? That's where they've got to in their world. So I think part of that will be, is there a framework? So you all touched on it. The governments are looking at frameworks, but I think industry as a whole has also been looking at frameworks themselves, right? To say, health systems are looking at it from how do I deploy this in two categories, I think, Sarah. One is around boil the ocean, how can we change the delivery of care globally, blah, blah, blah. But I think in your report, it also shows that there are some little things people are doing to help workflow or efficiency or things like that, right? That seems to be one area. And the second area seems to be around, in looking at the report, the big guys now coming into the market and using this as a Trojan horse to swallow up the little fish, as you said, Gil. Does that showcase that in your report, Sarah? And then, Gil, I'd like to get your opinion on that.
Well, Ritesh, that was one of my biggest takeaways. I mean, we showed the ecosystem, what it looks like, but my biggest takeaway was, wow, those big four we talked about, the Google, the Microsoft, Amazon, now OpenAI.
Yeah.
This is like a wide open door for them to come in and really plant themselves squarely in healthcare. They've tried other things before, right? They've been playing with PillPacks and all these other acquisitions. They hadn't found anything that really stuck before. And with their Gen AI models, they're squarely stuck in the middle of healthcare. No one's going to be able to push them out. So huge, the number of partnerships that we're seeing with between big tech and digital health ventures, right, has skyrocketed in 2022. It nearly doubled. H1 already, you almost said, is May 2022, right? So the number of partnerships is really going up wildly because now it's an open door.
Interesting.
Yeah, I'm Ritesh and Sara. I'm with you, Sara, on this. I'm going to be a little more critical, though, of big tech for just a second. I think Amazon's sitting on something like, and I could be wrong, I think it's either 40 or 60 billion dollars of free cash. And so a lot of these acquisitions they make for a few million or even billion dollars, I think it's university education for Amazon. The One Medical acquisition, a lot of people say, oh, it's going to be game changing. And I think Amazon today would acknowledge, no, totally not. Maybe one day it will be transformative for Amazon because we're learning about health delivery, but we're not a disruptor in health. We're a dabbler in health. I would say, to the report's credit, Microsoft, which understands B2B and data application and sort of like the machine application of data. I guess if someone said of the big four, put your money down, my money's on Microsoft probably. And I'm not telling you go out and invest in Microsoft, but I think Microsoft understands the B2B market. I think Amazon understands the B2C market super well. I think Apple understands the B2C market. I would look at a B2B player in the use of Gen AI first and foremost. I do want to talk about something that does concern me around the machine learning or the language learning model when it comes to AI, and a very controversial study that came out in JAMA that said, and Ritesh is going like this because he and I have discussed this, patients, we're always people like chat bot, conversation and AI much more than they like speaking to their doctor. And I think that we have to be very, very cautious as generative AI models get smarter and smarter with the use of language. And that's going to happen in 2024. By the way, we're going to make quantum leaps. Here's the differentiator. You don't feel intimidated speaking to your laptop, do you? But when you walk in and you're wearing that little gown that opens at the back and your feet are dangling on the little raised couch there with the little like sort of slipper socks they give you, and Dr. Smith walks in and your pulse suddenly picks up to tachycardia-like levels. It's not pleasant speaking to Jane's eyeballs are popped out of their skull. It's not pleasant speaking to a doctor who's going to give you 8 minutes and you feel every second the clock is ticking. So you've written down on a piece of paper the 3 questions you desperately need answers to. But when you're in front of your laptop, it's like the internet doesn't know you're a dog, right? The Gen AI doesn't know if you're sitting there for 15 hours plumbing away of questions. And I think that if doctors don't feel threatened by Gen AI and are trained in medical schools starting today how to let Gen AI complement provider care, I think Gen AI could actually be a very good tool in preventive medicine. I think it could be a very good tool where it's accessible in reducing health disparities. I think it could be a very good tool in getting people who see some funny rash and are frightened to talk about it to sort of like go on and sort of Dr. Google it, to converse with a medical model and realize maybe they should go see a doctor earlier. So on one hand, I think that all these little players or smaller players have a vital place. I think the innovators or the small fish, I want to correct my language, the innovators, the smaller innovators, I think that they're the business development lab of the big four. And I think the big four needs them desperately, and they should press forward, and investors should understand that's where the big money return on investment is. It's not going to be on putting their money in an expensive Apple or Microsoft stock. It's going to be pumping their money on some pretty good management team with good talent on the smaller side that fits into and has the vision to do something practical with Microsoft or Amazon or one of the big four.
So you've answered one of the questions that Matt Whittingham put up, which was, will we see any larger digital health companies?
I fed that
own,
question to
right?
Matt. That's why.
Oh, you did? Okay.
No, I did.
So, but I think you've answered that, which is the big four are vying to have their standard being deployed in the healthcare ecosystem, right? So whether it's Bard or MedPalm or whatever it is, right? Microsoft's co-pilots that are being put together. Have you, Gil, just quickly, have you seen any other model? Have you seen any other company developing a health-specific model in your travels?
That's a really great question. And I have started to see a different type of company develop unique models in ways that we never imagined possible. I know this is going to sound wild, but I think that companies like Fresh Direct, all these food delivery companies, are actually starting to use their data about customers and Gen AI-like models to actually get into the augmented health business. In other words, they're
The
starting to
diet
realize,
business, yeah.
yeah, they're starting, not the diet
Yeah.
business. I think
Yeah.
they're starting to realize, we deliver frozen food in a container to your house. We'll take charge of delivering all your health needs to your house. We'll deliver your medicines to your
Interesting.
house. So I think they're going to see companies
The
like,
adjacent companies.
I think we're going to see
Yeah.
Walgreens and
Yeah.
CVS
Yeah.
um,
Interesting.
and Walmart. I think we're going to see them jump in. I could see a big player like a Walgreens or a Walmart or a CVS really jump in as a disruptor in the Gen AI market, because they're the intermediary of I'll call ongoing care. So I could see them becoming select players.
Interesting. Jane, I know you've done this personally, right? I mean, you participated in Project Baseline, if I remember correctly. How did that go? Because they're collecting a vast amount of data about you.
I'm still in the trial. I
You
enrolled
are.
in 2017.
Okay.
So that meant coming home at 27. Well, first reading a consent form that said you're going to spend 2 8-hour days at Stanford. I was like, never. Well, yes, it was
Yes,
true.
you did. Yeah.
And bringing home 3 different digital wearables and devices to collect data. What I think is really cool about it, though, Ritesh, is that longitudinal data and the expansiveness of the data sets they collected. It was not about healthcare. It was about predictive analytics and finding signals that were buried using these large data sets. And they were very intentional about selecting a very diverse set of patients. What was really fun to go to the in-person events was to see how many people over 65 were in the trial.
Wow.
But by the time we got to 2020, before COVID, they had already contacted more than 700 patients to let them know there was a signal in their data that no one had detected. Now, Google could not take any action on that, Verily could not, but they took the step, if you agreed as a participant, to alert you to something that you've probably never heard about it. And I personally know of 3 people whose lives were saved because of those signals in Project Baseline. Now, to me, that's the personification of how big data and clinical research will transform clinical care, to Gil's point. But the consent form was probably 10 pages of content around data, its usage, where it would go, what we didn't know about what they would do with it, what they couldn't tell us, what would happen with it, which was pretty fascinating. And I will say, maybe we were naive, but the people who enrolled were in it because they wanted Google to have access to that data.
Interesting. Sara, were you going to say something?
Yeah, no, that's a great story, Jane. I appreciate you sharing, because that's really one of the biggest challenges we see when we're talking about AI and Gen AI in healthcare, right? That's the data. In the report, we list a bunch of challenges. And I'm sitting in Europe, right? Europe has the data privacy laws are really strict. So it'll be interesting to see looking forward, how those European ventures, which were compared to those in the US, which doesn't have as strict. But anyway, going back to challenges, right? I mean, for sure, allowing to use their data, but then that data availability and quality, right? What type of people are going to allow the data to be used, right? Is that going to then skew the data and bias the data? Obviously, it's a huge concern for everyone involved, right? Data ownership. If you have ventures owning the data, do you have Google owning the data? Do you have the pharma companies owning the data? When they collaborate, how do you share? Who owns it? Who owns it? It's a big step. We've already talked about regulatory compliance. Biases, I think, is one of the things that everyone knows about, those biases in the models, trying to design so you don't have bias, and then you design another bias, right? And then the privacy and security. So, those are the big topics that really concern people about Gen AI. That's what the regulators are trying to help with. But the fact is they're still there, right? That's why the chatbots, typically they use a predictive AI, they don't use generative AI, right? Because and hallucinations because the biases were just not there yet. But kind of going back to what Gil said, about people like talking to. I was at Frontiers Health last week, heard a presentation by Robot Health, which is one of those big healthcare companies that has the chatbots, and they said they did a study, right? People are more open with a chatbot than they are with their physician. It's just
I started using Robot when they launched on Facebook as a chatbot on Facebook. And I
right.
tried to break it, and it was
talked about
fantastic. Really well done. Really well done.
They just don't think the chatbot's going to judge them.
No,
Right.
That's
exactly.
a great point, Sarah.
Exactly.
So
right.
really breaking down one of those fears that people have. And Gil, I'm glad you brought it up. But anyway, there are a lot of challenges still with AI, with Gen AI. But absolutely, having the data, having access to it, being able to glean those insights, James, you're talking about identifying things that it's just too much data for a physician to understand and put it all together, right? For any human to put together. And that's the advantage of AI.
So let me ask, sorry, Gil, I'd like to ask Jane a question around, we've talked all sort of high level, we've talked about data collection. Where are you actually seeing generative AI today that you think, aha, wow, that was a great thing, or I think that's going to work? Have you got any examples that you can sort of talk to us about?
Sure. So as you said, identifying new drug candidates and targets, and to Sarah's point, really optimizing protocol design.
Okay.
I think those are two places. I'm actually pretty interested in how we're going to use it to find the non-investigator physicians to become investigators.
Oh, so changing the whole feasibility model, right?
Yes.
Interesting.
And potentially even helping those physicians understand the difference between clinical practice and doing a clinical trial with support models and decision support through generative AI. So I know this is very nerdy, but imagine if you had a chatbot that helped you navigate GCP and ICH as a de novo investigator.
That would be amazing, actually. You're right. I never thought of that.
I think I better go work on that.
Let's I don't know if there's any people on the call who may want to do a startup around that. I'm sure that
I could see some companies though that I think are going to be, I mean, I could name companies, but I could see companies listening to you right now, Jane, and just charging off to the room before you get there.
That's okay with me. I can help you generate the questions. I can't code the model.
I think that Ritesh's question is one of those spot on practical questions. And, that's the differentiator between trying to be a visionary and trying to be a pragmatist. I think that for the people who are thinking of new ventures or have new ventures, first of all, I would really lean heavily into the pragmatic aspects of Gen AI, and looking at the unmet need in terms of Gen AI. Look, it wasn't that long ago where all of us were talking about, Sara used the term big data. That was, let's say, a decade ago. And I'd be on calls like this.
No, there was a data lake last week I was talking about.
So people would say big data. They'd say, Gil, tell us what exactly is big data? And I said, well, it's a lot of data. And then, right. And then they said, what's machine learning? What's machine learning? That's using your computer to look for patterns of the big data. And now we're talking about generative, augmented intelligence. We're about to enter into this hyperspeed aspect of how do we utilize information in order to make very wise, informed decisions about what investigators aren't being invited to a trial, who should be invited to a trial, what patient population is not participating, and we need to emphasize getting them into the trial. We need to look at safety signals or even patient risk signals. Look, Gen AI is definitely the door opener to all of that. But I also wanted to go back and circle to what Sara was talking about moments ago, because there's a tendency to get so excited about the technology and its possibilities that we forget, along with the pragmatic application, the pragmatic problems. I think when you have this much data centered around X amount of systems, it is an invitation for hackers and the risk of cybersecurity, sort of like slip-ups. When we're now contributing so much of our lives into the machine, who protects the machine and therefore who protects our lives? As they find out more about us, they're going to have predictive risk associated with what they find out about us. You talked about that, Jane, in terms of the trial. 4 or 5 people had a signal that was a life-threatening signal. What are insurance companies going to do about that? In this country, now they have to cover you regardless of pre-existing conditions. Will they try to say, no, before we cover you, we actually want to run your whole history and family history into a model to determine our risk, like life insurance? They could say, I don't want to cover you. You're too big of a risk. So, I think that we're dealing with some policy minds that we've yet to explore. But to make Gen AI work, it's got to be equitable. It's not that it works for Google or Verily or Microsoft or Amazon. It's got to work also. It's got to work also for the individual. If it's not working for the individual, that collection of individuals will rise up against the technology.
So if you go that route and you go down that thinking, there is a fear today that big tech will control too much, as they've already done, right? Do you foresee some changes? I know, Sara, you mentioned the regulatory changes by governments, but is healthcare doing anything? Do you see anything in your patterns around regulations by the industry or by providers, or is it currently still at the government level?
As within the US, I know there's the Gen AI model builders, right? Big tech.
Yeah.
They're very active in building regulation, right? And trying to shape this, which probably isn't a good thing because they're building their own rules, right? And will skew them. Within healthcare itself, I personally haven't seen any big regulators or any other bodies stepping forward and saying, no, we're going to push to move this in a particular direction. I have to admit, it's mainly coming from regulators, because at the moment everyone's kind of running to catch up with it, right? To understand what can be done.
I wonder if ONC or CMS or HHS or one of those bodies may be looking at this skill, probably.
Or FTC. I think
the FTC,
I actually do think that I think Jane has touched on some really critical FDA, CMS related issues in terms of what's the protocol for using Gen AI related data. But to your point, Ritesh, and I think you've kind of touched on the painful truth, which is too few players having too much power.
Yeah.
And the risk of monopoly in terms of our life information. I don't have an answer to that, but I think people should be relatively concerned about that. And how will that data be used for us or against us? I think we're heading into that sort of situation of predictive models of behavior even. Will you be an alcoholic? Will you be a citizen? Will you be a criminal?
But
We've
there are
seen
some good
movies like
things
that.
coming out of it, though.
Tom Cruise covered that.
Minority Report, yeah,
Yes,
exactly.
Minority Report.
But there are some good things. Look, I see, and I have personal experience with a number of friends who have used Noom. Noom is a great example of a consumer product using sort of predictive modeling. It may not be generative AI, but it certainly is machine learning based modeling that they use to help you lose weight, which in turn results in better health, right? So there are some good examples. And I think, Sara, you guys pointed some of them out in your report, like the 3 companies that are doing interesting things in clinical with Atomwise and in silico, but also the areas that they're working in, right?
Absolutely. And just to quickly touch on something that Gil mentioned, which is like this monopoly, right? It concerns me that the big tech is kind of embedding themselves, but they're not the only ones making Gen AI models. Someone asked it, I think, in the Q&A.
Yeah,
right.
Ravi did,
Recently saw a company from Germany called the Blue.ai who's creating their own models, right? So there are definitely other companies focused on healthcare creating the Gen AI models. So we need to something to keep an eye on, obviously, and something to proactively understand who are the players and make sure we don't pigeonhole ourselves there. But I think that will come out, right? Ritesh, I'm getting back to the benefits of Gen AI, right? If we're looking for health systems, we know there are a lot of inefficiencies in our health systems, right? But there are so many solutions there using Gen AI or using other forms of predictive AI, right, to solve those solutions. I mean, diagnosis and treatment, right? You're never going to have likely never have AI completely do the diagnosis without a physician in the loop, but you're saving a lot of time with those repetitive case, testing for, let's test for COVID. Okay, another test. We can do that using AI, right? The efficiency of the administration. We talked about that a little bit before, the note-taking type thing. And then the reimbursement. There are now even tools, for consumers, right, to help them write the reimbursement forms. Right, understand the Gen AI can spit those out, saying these are my conditions, this is what the codes I was given, please write my reimbursement forms. The inefficiencies that can be addressed here are huge, and those are something that aren't highly regulated right now, right? And they can be solutions that are already on the shelf, right? They're solutions that are being used. The diagnosis, the treatment, that will come, right? And I think Jane is in a area of the clinical trials that's a little bit more forward looking into the future as to what will come and how we can improve the efficiency of drug development.
I'm
We didn't
going to
touch
call
on.
out something that might be obvious. All of the big pharma companies have generative AI LLMs.
Yes.
They just don't talk about them.
Yes.
Yeah.
They're not public
Right?
about it. Absolutely right.
They are trying to use that capital to fuel their own vision and business models. But I think it's really fascinating now that I look back. I think my first experiment with AI, not generative AI, was probably 2015. And I was not the first adopter in that domain. I was just getting to ask the questions about safety monitoring and how we would do that. So the startups are very much involved. So are the big players. They just may not be telling you where they're headed with that data.
Interesting. Matt's asked an interesting question again. Sorry, Ravi, we answered your questions, and I think you're right. Generative AI plus humans, as Gil always tells us, may be the backstop for hallucinations and all sorts of things. Gil is very passionate about empathy and building empathy into these things. So you're spot on. But Matt has an interesting question around timescales. When do anybody, and maybe Gil, you want to take this because you're running around the world talking to all sorts of people. When do we think we can show Gen AI making a real measurative economic impact, like HEOR stuff, health outcomes? Do you think there'll be a time?
I think it's happening already, Ritesh, but I don't think people are talking about it because, along with our fascination with Gen AI, I think there's also some sort of like fear and skepticism, and I think that the data is already being created and deployed in some countries' health systems that have, we'll call it government-sponsored care. The U.S. is a bit of a laggard when it comes to deploying data in a positive way. This is the biggest. I think it's about 19% of our GDP now is health related, just a little bit less. European nations like Germany and others, it's about, I'm going to tip to the higher scale, it's about 7%. They live about 10 years longer than we do here. So we're not getting value for our money. But I think the European system, like NHS, for instance, has been using selectively Gen AI models in certain communities. Again, it's not uniform. I do think you've touched on something, Ritesh, that is sort of an enduring problem, which is for Gen AI to have its greatest potential to help heal or advance the science around medicine, humanity has to get a little more comfortable with it. And that starts with a new generation of health providers, not just physicians, by the way, nurses at all levels, physicians assistants, support staff in the health system. The challenge, I think, right now is a mindset challenge. It's not a technological challenge. It's a behavioral challenge. I don't think doctors, particularly who are used to having a stethoscope around their neck as a sign of power, want to be partners with
A
machine
machine.
learning.
Yeah. Yeah.
Right. And I think that as long as they understand it's not virtual reality, it's extended reality, it's an extension of their ability. It's not artificial intelligence, it's augmenting their own intelligence.
Mhm.
I think that we have to change our mindset about Gen I in order to allow it to fulfill its greatest potential, which is to advance access to and the delivery of health.
So, big question. I know we got about 7 minutes left. I'm going to meander to this because we talked about it a little bit. Data, 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 data everywhere, right? Here in the US, it is just a nightmare. And the industry has been working on interoperability since I was a child. Right? And I will hear the words, and with the standards will fix it. HL7 and Fire, and everybody's deploying Epic everywhere. Do you see a different thing coming now? My view is that generative may not require standards because you can connect it to any kind of data set, right? What do you think? Jane, maybe you first and then you, Gil.
Well, I'm hopeful because it has to be better than what we're working with now. One of the challenges, I think, is that so much of the data that is pertinent in healthcare is in that unstructured domain in the data set. So if the generative AI models can help us access, make sense of it, and structure it, that's a huge win. I will not be the person to solve for that, but I will be thrilled when it gets solved.
Gil, what do you think?
First of all, I do agree. I don't think the problem is with Gen AI. I think it's with our existing structures. Look, the reality is we've always had a form of Gen AI in human behavior. If we think of the greatest physicians that we've turned to when someone calls me up and says, I've got such and such of a diagnosis, can you get me in to see someone you know? I realize when I'm introducing them to a, quote, great physician, it's because of their individual pattern recognition skills that actually within their own little brain microprocessor, their ability to generate or scrape data and see information that doesn't exist in the file is extraordinary. And those physicians have always existed. And those physicians, I think, will rise to the top. So in other words, Gen AI will not make a smart physician less smart or less like, wow. Actually, I think those physicians will have the cognitive ability, intellectual import to use Gen AI to the fullest.
Yes.
I think a fair physician, or I apologize, perhaps a less competent physician will actually continue to be a less competent physician because of their emotional fear factor of looking at the machine and realize, have I made a misstep here? Have I missed something?
Yeah.
Medicine medicine itself is the villain at times. You know, when a doctor doesn't know something, they have a term for it. It's called, hey, you've got idiopathic, whatever. They don't say, hey, I don't know what you have.
Yeah.
They have
But
a
let me
great,
go talk to someone.
right. Let me go to a Latin word to describe what I don't know. So I do think that Gen AI is a freewheeling, open source tool that can take data and mine it to the max. It can make the open-hearted, open-minded health professional that much better. It can give some parity to the patient, to the person who has a health concern. And I think it can increase the imaginative ability of drug developers to think outside the box.
And even
And
entrepreneurs, right? All the entrepreneurs that are using those open AI models, they can come
We just
up
have to
with
give a
new
plug
uses.
to Galen Growth, though.
Yes.
I read these reports that Galen Growth, Sara, others produce, and they make me that much smarter.
Yeah.
I mean, if I'm a pretty astute person, I like to push the envelope as you do, Ritesh and Jane and Sara, My hat's off to you and your colleague, Sara, for making this conversation even possible.
You know,
Thanks,
as
Galen.
Valerie said on the chat, you know, proper change management will help here. So I think that's going to be the big thing. Sorry, Sara, go on.
Absolutely. No, I think adding on to what Gil said, you know, I think this Gen AI is really going to put the doctor back into the loop, right? Allow them to do their job, take away all the administrative tasks, right? Automate the procedures that we know about, and really get those great physicians who can see things that, you know, there's just a very complex pattern to it, right? And that's what we need, right? The computer can see the patterns, right? We need the ones who can see beyond that. But you know, when going back to the connectivity and bringing the EHRs together, right? It's kind of a lot of it depends on sharing data ownership, right? Are the health systems willing to share that information? Are they willing to, you know, allow it to go into the bigger system to pull the data into a more structured manner, or unstructured if the Gen AI allows us? Really, who does that data belong to, and are they willing to share that? Which is key to being able to use Gen AI.
I'm going to have to just put on my patient conscience hat here now and say, as we think about the change management need, it has to go beyond the tech developers and the physicians. The public needs to trust that the data is being used in service of their well-being. And my 19-year-old does not. He's an engineer. He does not trust that these big tech giants are really going to take his data and use it for good. So I think we really have to pay attention to bringing along the population so they understand they don't have to know how all of the analytics were done. They need to know and believe that the purpose of the analytics is for their good outcome.
They should all watch Big Hero 6. We should make it mandatory. The robot will pop out of the suitcase and scan you.
I'm ready. But
I think that's a good conclusion, Jane. Make sure the patient is put first. And the patient is the focus of this change management.
And I think we shouldn't call them patients anymore, but people that we're treating, right? It's just, look, it's human beings.
Always people.
Right.
Absolutely. I think so. We've got 1 more minute left. Just to let everybody know the report. I think I put the link in the report. Sheena agrees with you, Jane. She says, here, Jane. So there you go. You're all there. And Anand, thank you for sharing that you're using the OpenAI model in your business. I hope your business succeeds wildly. Galen Growth, thank you for the report, Sara, and the webinar. Jane and Gil, thank you for your participation today.
And Ritesh, as always, you're a magnificent moderator, making it fun and enticing.
Excellent.
Thank you for hosting.
I look forward to continuing this conversation when your next report comes out, Sara. For all of you on the call, go check out, galengrowth.com, I think, right? Galengrowth.com.
Absolutely.
And there's a bunch of stuff there that you should really look into. And thank you, Sara, for getting those reports. Yeah, go to the research page. With that, have a great day, everybody. Thank you for joining us. And I'm sure this is recorded, so they'll be put up somewhere. So look for that as well. Have a great day, everybody.
Thank you. Bye-bye, everybody.
Bye for now.
Bye.